patient of mine, whose daughter was coming to see me. Can we talk a little bit about what she's been through, just so other people that have gone through that sort of that medical model, in terms of, just being put on metformin and being told that, it's hormones imbalance. When you look deeper, it goes much, 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 much deeper than that. Does that make sense?
Yeah, absolutely.
Okay, all right. So what I'm going to do here is I'm just going to open up her profile so that I have the initial time when you first came to see me and kind of go from there. So is that okay if we do that?
Yeah.
Okay, awesome. All right, so I'm just going to introduce you. So hello, everyone. My name is Dr. Joel Rosen. I'm here with a great patient of mine whose daughter came to see me early in February. 17-year-old daughter who was dealing with some hormonal imbalances, and she's had symptoms like weight gain, brain fog, joint pain, tired most of the time, and really you'd been to the pediatrician. So tell me a little bit, Sheila, about sort of that process leading up into having Angelina coming to see me.
Okay, so when Angelina first started going through puberty, I noticed big changes in her, not feeling good, really kind of breaking apart and gaining weight. And so the first visit I went to was the endocrinologist, who said she had clinical signs of PCOS because we had a little hair growth on the face, and everything I was telling her about her weight gain. So the doctor put her on metformin, which did not work, made her very sick. She still was gaining weight. We went back to the doctor again, and she decided that maybe, because she's not getting her period, maybe we need to put her on a birth control pill. She got really sick from that, gaining weight, not feeling good. All these things that the endocrinologist was doing was not working. They noticed that the weight gain was there. Okay, if this isn't working, let's do an MRI. We looked at the MRI. We found a small tumor on the pituitary. We treated the pituitary with a hard, medication that they suggested. She got very sick. Pituitary shrunk. Everything looked fine. The doctor said she's going to be okay. She went into a storm, the perfect storm, got sicker and not feeling well. So I knew that it was time to seek someone that can really get into her insides and tell me what's going on. So that's where I found you. Right. And we started in February. She weighed 188 pounds. 6 weeks into your program, she lost 14 pounds, started feeling better, started looking better. And, here we are. We're on the right track and finding out really what's going on inside, just not, on the outside of
yeah,
guessing.
A lot of praise has to go to you and her for being troopers in what we needed to do. So you guys initially took advantage of the, I think it was an Adrenal special where we did a before and after blood, urine, and saliva test. Yes. But we also layered it on with looking at her genetics, and seeing if there's some susceptibilities. And people always ask me, what does that have to do with, if anything? And what it really has to do is it just gives us a lay of the land in terms of, is there a susceptibility for this person to not clear out her hormones properly if there's inflammation? Or if there's an infection, is there a susceptibility to not recycle and put the infection into a latency mode, almost like stomping out a cigarette butt? Or is this person good at repairing their cells and their DNA? And what's going on with their stomach terrain? Is there microbial overgrowth? So we did see that, right? We saw some findings of candida and yeast overgrowth, and then usually we'll do a stool test if warranted, and we'll see microbes in terms of additional dysbiotic bacteria or things that produce autoimmunities, which she happened to have in terms of an immune-based problem with her thyroid. And most people will be put on thyroid medications when it's the immune system that's acting up. So we've gone forward now and reviewed your genetic test and said, hey, here's some problems with her Angelina's detox pathways. You had already been starting to use the nutrients to help make more antioxidants like glutathione and Maxim B to help her methylation cycle. So now we're going to layer it on with a couple other targeted nutrients. You've been doing castor oil packs. We found out that there's a parasite, so we got a parasite protocol. We've been doing candida protocols. So tell me how she's feeling. Tell me how she's doing.
the amazing thing is 7 months she did not have her menstrual cycle. She started that just this month, and going to the chiropractor every week. This was the first time that she held her adjustments, and she is just feeling emotionally better. She's a happier kid. And she's looking great, just looking great overall. I mean, you know, I went to 2 different specialists, and the second specialist let me know the only thing I left out of there, her saying was, it's complicated. Because it's complicated because they stay within their protocol. There's nobody outside that box. That's where you are so outside that box, and really got in there to find out what's going on. So I know she's, you know, going to be all right now. It's a great feeling as a parent.
Yeah, and you know, and again, kudos to you, because I know you push her, you have her exercising and sweating, and you have her, you know, it's not easy to tell a kid, hey, you're not allowed to, you know, eat gluten, but you know, the reward certainly weighs the sort of the risk or the you know, the sacrifices, and what we're talking about is giving you not just a one-time thing, but it's a sort of a verb in terms of, okay, we understand we always got to keep this gut health working properly. We got to make sure that her liver is working well. We got these weak links in here, like for example in Angelina's case, she doesn't convert vitamin or beta carotene into vitamin A. And that's a problem with mucous membranes. So our mucous membranes line our guts, so leaky gut's more susceptible, leaky brain, so brain fog, focus, concentration. If there's parasites, that can create more, you know, brain fog. So really, we've given you the tools for her to, you know, really be a normal kid, right, and be able to enjoy her life.
Absolutely. One of the biggest things Angelina used to do is get a glass out of the cabinet and walk away and not shut the cabinet door. She's shutting doors without me reminding her to shut the doors. That's huge. That's so huge.
Right.
That all has to do with that neurological, the connection from the gut to that, but nobody could tell me that, you know, so
Right.
That's been amazing. So I know this is lifelong. This isn't something that, you know, you just do one day. It's a lifestyle change. I teach health and fitness, and it is about lifestyle. Everything that you do and the habits that you do, and, you know, the everyday, you know, it's just like brushing your teeth. It's got to become her lifestyle. And it is hard. It's not easy. But once you adjust to it and it is your lifestyle and you feel so much better, you don't think about anything else.
Totally. I couldn't say it better. So yeah, I appreciate you sharing this, because there's other people that I'll tell them, hey, yeah, I can help your daughter. But until they hear someone else whose daughter has been helped and who's done it, then it sort of resonates a little bit more soundly for them. So I appreciate you sharing her story.
Thank you. Thank you so much.
Thank you.